know where I know him from.
All right, so do you want to talk about, you said you want to talk about 8 extras or divergence and
I
stuff?
would love to. Yeah.
Just, do you want to talk about one, like specifically one aspect of them, or do you want to do like just like a broad look at what's happening with the whole 5-channel system?
How about a broad?
Yeah, I think
First.
Yeah,
Yeah.
broad
Starting
can
from
crush
that first.
because I don't think a lot of that's going to be on comps this year.
Okay. Just
Um,
maybe general questions.
Right.
I mean, if
Things about
anything, like it would be good to review all of the just 12 channels, you know, meridians, like where all the which one goes in the eye. Like I've already forgotten.
Yeah,
Right. I know gallbladder. We were talking about which channels go into the brain. Gallbladder
yeah, gallbladder and liver.
and liver.
Yeah, those are like the two. Well, those are the
Bladder.
channels. Gallbladder and liver are the organs that are responsible for the nervous system is a tissue of the liver. So it's like gallbladder and liver are the organs that are managing the nervous system, including the central nervous system.
Yeah.
Yeah.
That's what in treatment disease he was talking about, like with the nervous system and stuff.
Yeah, and like liver moves into the brain and gallbladder brings things out of the brain. So it's like afferent nerve signals are liver and then efferent nerve signals are gallbladder. So when it comes to like looking at it diagnostically, you're looking at like like liver is sensory, gallbladder is motor. Yeah. So like I see a lot of people for neurological issues. I'm more interested in that than just about anything. So I like looking at that stuff. But yeah, when I was in school, I feel like we didn't explicitly talk about that, like the liver being related to the nerves. They were always saying, well, the
I don't
liver.
remember hearing that yet.
Yeah, but it is. Yeah, I feel like we always, they would just say the liver's related to the sinews, and then they would leave it at that. But the nerves were never really mentioned ever. I don't know, but it is. It's a wood element tissue.
Okay.
So yeah, and you'll see that all of the, all wind disorders, all the neurological disorders are wind disorders. So I mean, they say it without saying it.
Yes.
Yeah.
Okay, so that's a
Yeah.
yeah.
Yeah,
That makes
but yeah, I mean, in terms of the 5-channel systems, I mean, we could like start looking at like kind of an overview with it, and then figure out where we want to hone in on it. So of course,
Do
huh?
wasn't our do class do's responsible for sensory orifices and face?
What?
Are you're saying is like the do mind related to the sensory orifices?
Yeah.
I don't know if it's explicitly related with them. I mean, the do is obviously, central nervous system. It's like the spine and moves up into the brain. And it's just like managing all the movement of yang qi. So it's like, I mean, to a certain degree, you could say that like the ren and the do are connected to everything, because it's like the ren is like the source of all the yin qi, and then the do is the source of all the yang qi.
Outside
So
of the primary. Okay.
yeah. So I mean, yeah, to a certain degree, yeah. And of course, the do actually comes down through like this region, so it's like interactive with the face too. But yeah, normally I haven't heard people say too much about the do mai being like explicitly related a lot to like the orifices or anything. But yeah, I mean, basic overview with it is like sinews are the most superficial. The sinews are avascular, right? The substance moving through the sinews is the wei qi. And the wei qi, like I said, is mostly the fluid substance of the wei qi is the gene fluids, the exocrine fluids. So really the sinews are the ones associated with the sensory orifices, because all the exocrine fluids are the ones that lubricate all the sensory orifices. So it's moving through the region of it's the, let's say, like the superfascial and subcutaneous region. So it's that space, superfascial and subcutaneous, the space between there, everywhere. It's the coulis.
Okay.
Yeah, so this is the coulis. So, and the fascia wraps all the muscles and it wraps the bones. So the Wei Qi moves and the sinews also move in around the bones and around the joints and everything. So it's not, I mean, we think of this as being like the most superficial type of qi, or like the more kind of, it's like a very coarse type of qi, they actually say. It's like, they say that Wei Qi is very coarse and very slippery, is like the qualities that they attribute to it classically. But we always think of it as being on the surface, but it also goes down into the bones and everything too. So the sinews, physically go fairly deep in the body. The energetics are kind of a superficial type of energetic, but physically it's also penetrating deep into the body. And yeah, I mean, sinews are the most straightforward of all of them. Do you guys have anything that seems unclear about sinews that you want to chat about? I mean, you have a special relationship with Jingwell points on the sinews, right? Mm-hmm. So you're always using the Jingwells, and then you have the confluent points for the sinews. So these are the only considerations to think about, really. Yang arm sinews, yin arm sinews, and what's the other ones? I forget sometimes. The chest here at Ren 17, is that the yang leg sinews? Like Ren 17, you guys learned these much more recently than I did. And then I think yin leg sinews is down here, like Ren 4, Ren 3 or something like that.
We only had our meridian overview class. We haven't had our Sinew class yet.
Okay. Yeah, so it's like, so the confluent points for the yin sinews are on the abdomen, and for the yang sinews they're on their head. So if you're working with like kidney, liver, spleen, you go here to like the region like around like Ren 2, 3, 4, this area, and you release that. If you're working with gallbladder, bladder, stomach, you're coming up here to the chest and releasing that. And then, like I said, small intestine 18, stomach 3, that's the arm yin sinew confluent points. And then the arm yang sinew confluent points are gallbladder 13, stomach 8. So you're just going to that region. Classically, they don't name the points, they just name the region. So that's why they'll say, well, it's kind of this point or this point.
I remember struggling with like just memorize what does confluent point like.
Yeah. Well, confluence means where things come together, where things join together, or where they flow together, literally in Latin, con meaning together, and then fluent meaning flowing. So the idea is like that's where the energetics flow together, like so it's like it's a crossing point essentially. So all the yin leg sinews come up and they cross here. They all join together right here. And so you can go there and you can test to see if the fascia feels tight there, or if it feels like there's like some kind of compromise in the fascia. So if you want to check a sinew, you just try to lift the skin up away like this, and that'll tell you whether or not the sinew is compromised, whether it's like drawn in. So if it's drawn in and you can't get any lift or you can't get any play here, then that's a good indication that there's cold in that sinew. And normally that's what you're treating, either wind or cold in the sinew. Wind also will cause everything to draw in. Mm-hmm. Very rarely are you like treating a sinew channel for heat or something else. Usually it's wind or cold. So usually that's what you do. You kind of pinch and kind of feel for it, and that'll give you a sense. So you can go to the confluent points, and on the scalp you just see how mobile is the skin. Can I get the skin to move underneath my fingers? Coming here, can you get the skin to move underneath your fingers? If you try to lift away, does it feel tight? And you'll be able to tell. The quality is very different. So palpation is really big with the sinews. And I can tell you, I don't do much needling on the sinews. I find the needles to be extremely difficult to use relative to other modalities. Like if someone has like a sinew that's locked up and doesn't move properly, I will use moving cups. Like I'll put cups on there and move the cups along the sinew. I'll do the Jingwell and the confluent point, and then I'll go along the sinew with massage or cups or something.
Versus needling.
Yeah, versus doing this kind of needling stuff. Or I'll lift and roll. This technique where you lift and roll along, that's really good for releasing the sinews. Yeah, all that kind of stuff, it's really helpful. So for sinews, that's what I do mostly.
Worked with any many injuries, like shoulder injuries?
Sure, yeah. Yeah, I mean, you can use needles for it too, but it's like as soon as you get that needle into any space where you penetrate through the fascia, you're in the yin qi. So you're not on the sinew anymore. So it's like when you're working with the sinews exclusively, you're not really allowed to go into intramuscular. You don't go intramuscular because that becomes yin qi territory.
This is where you chisel?
Yeah, you just chisel along the surface, and it's very energetic. If you're using a needle, you have to be like really moving the Wei Qi with your Qi. It's not mechanical at all because it's like, you're not using that little needle to actually release the fascia. So it's really energetic. And so it's really subtle if you're using a needle. And I find it's just way easier. It's way, way easier if you have somebody that's not a Qigong person or something to just use a cup to release it. Because the cups are like a Sinew channel modality.
Or like gua sha.
Yeah, or gua sha. Yeah, exactly.
So for Sinew channel issues, you wouldn't be thinking necessarily like orthopedic issues?
It can be, for sure. Yeah, it can be, because the sinews are also, of course, related, like the tendons and ligaments are a sinew. The sinews are all the white tissues in the body, and this is language that I got from Tai Chi, because in Tai Chi, they're always talking about the sinews. It's all the white tissues. And this is another way of saying it's all of the, the tissues that are primarily avascular. It's like the interstitial regions of the body. So yeah, it's fascia, ligaments, and tendons. And we think about the divergence as having this like special case where we're like, oh, suddenly the Wei Qi is like interactive with the Yuan Qi, and it's a really interesting case. But even the sinews, the sinews naturally are tied to the bones. Your sinews like go down and they root into the bones. It's like you have all these fascial planes that go down and they bundle and they wrap around the bone and they like terminate on the bone. So that's really normal physiology. So the divergent business of connecting Wei and Yuan is not like a strange case or anything. So if someone has like some kind of, orthopedic issue or whatever, yeah, you can absolutely think about using the Sinew theory. And then you can use all the different modalities you have, Also heat, sauna is excellent for, releasing the Sinew channels and stuff like that. Exercises. There's usually with Sinew type stuff, usually for me, I'm prioritizing people warming up their body, boosting up the Wei Qi with like supplements or with foods or things like that, getting the Wei Qi to mobilize, and then doing exercises or something to release it outside of the office.
Would encouraging like better fluid intake and stuff like that to help moisten the sinews?
So you definitely need the water component. If the sinews are dry, then it depends on how dry. If it's just like a deficiency of like the gene fluids, if it's dryness like that, then it's easier to really resolve. They just need more electrolytes. You just want them to take like electrolytes, to do like magnesium and calcium and potassium and those sorts of things, and like that'll boost up the gene fluids. And then just having like good, drinking water or whatever too. But if it's like the sinews are dry because it's like there's a yin deficiency, then it's a different component. Like if they have like creaky sinews, like when people move their joints and they're creaky, that's like a yin deficiency dryness, where like the tendons and ligaments are actually dry and they're like rubbery, and so when they move there's friction. That's like liver yin deficiency stuff. That's like where the liver is related to the sinews. Because again, remember, the liver is the organ related to the sinews. So you have like this, so the Sinew channels, it's always liver and lung. Those are the two organs that are like tied in with the sinews, because the lung is governing Wei Qi, and then the liver is the organ that's like related to the sinews overall. So it's like those are the two organs that are associated with it. And like if you want to translate from Sinew channel to like primary channel, that's the bridge.
Okay.
Yeah. So then you're using herbs or substances or things that enter into those organs if you're trying to affect the sinews.
So then, this might be getting into the weeds, but in the case of like the liver yin deficiency that you're explaining, would you still encourage the person to do those workouts with the dryness?
If there's yin deficiency, you always want to be careful.
Yeah.
You always want to like caution the person, like don't do too much. Yin or yang deficiency to any extreme, they don't want to do too much. But yeah, if there's yin deficiency, they want to be resting a lot. You want to have them resting more. I give them lots of food and supplement recommendations for yin. Like if it's liver yin deficiency, then I usually tell the person you need to have fish oil. And I'll tell them, depending on how big of a person they are, like 2 or 3 grams a day of fish oil. I'll tell them to supplement spirulina. I'll tell them to have seaweed, and then things like eggs and meat. So that's normally, and dairy is the other big one here. So these are like tonify liver yin protocols. this is what I get people to do. Forget about herbs. I mean, honestly, I feel like herbs are kind of pointless when you can do this, because this is so much stronger than most herbs are. I mean, the herbs are kind of niche and everything. This is really easy for most people, you know. This is like, have you guys heard of the Budwig diet that they use for certain types of cancers? They use it for like estrogen dominant breast cancer and stuff.
What's it called? Sorry.
It's Budwig, like this. And the Budwig protocol is you do like 4 tablespoons of flaxseed oil and a cup of cottage cheese, and you do it like 3 times a day. And flaxseed oil is really high. So fish oil is really high in a certain type of, it's high in these 2 omega-3s called EPA and DHA. I forget what that stands for. But then flaxseed oil is the other big natural source for omega-3. And flax has linoleic acid in it. And usually I think it's alpha linoleic acid. But yeah, linoleic acid is is the big plant-based source of omega-3 naturally, and it degrades really fast. It's a really powerful antioxidant and degrades really, really fast because it oxidizes so readily. So you have to be really careful. It's got to be like freshly milled and refrigerated and all this stuff. But yeah, so they use that to nourish the liver yin and the lung yin. And it's just providing huge amounts of like yin when someone has this kind of heat problem, like cancer. But yeah, this dietary stuff. So flaxseed oil also nourishes liver yin. But
I guess in that case too, you're actually teaching the person how to eat healthy on a regular basis.
yeah, this is way better. Yeah, because I mean, if you tell them make these herbs every day, it's like, how long are people practically going to go along with that? Like if they're really interested in it or they're really sick, they will. And if they're seeing results, of course, obviously that's a motivator. And if you can take it in capsules, even easier. But they're going to be eating anyway. So it's like a lot of times, you know, you have to start with the diet. It's like, I don't know, did you guys see that chart where it's like the layers of intervention, you know, and it's like first you pray with a person or whatever, and then I don't know, it's like you first, it's like you have these layers, and diet is always one of the first ones you want to go to, you know. It's like you want to remove problems. Or if someone has yin deficiency and they're having a diet that's like really high in omega-6s, if they have all these free radicals in their body, right? Like omega-6s introduce huge amounts of free radicals that create heat in the liver and the heart. And so if someone has like those heat patterns and you give them something to nourish yin, but they're still cooking in canola oil every day and their body's flooded with omega-6s, then they're going to stay in this like really high oxidative stress state, and they're going to stay in that hot pattern probably. I mean, they're probably not going to be able to overcome that with like supplementing fish oil unless they take a ton of it. I don't know. So yeah, so I'm always starting with diet, but yeah, we're kind of deviating from the 5-channel system. Does that make sense though? Or did that answer your question about that? Okay. I don't know if we even had a real question. But anyway, just rambling about things. But yeah, so the sinews are, like I said, it's Wei Qi territory and it's avascular. So this is like the characteristic thing about the sinews. And then you have normally they'll say the Luo is here. And of course, Luo means net, right? The word means a net, like a fishing net or something. And the Luo are the capillary beds. So it's the vascular network. It's this capillary network, this like microvascularization throughout the body. So that's what the Luo is referring to. And some people will say like the Luo vessels don't exist until there's a pathology or something like that. But really it's referring to that structure. So this is vascular, obviously, and you're dealing with yin qi here. And yeah, I mean, not much to say about the Luo. The Luo it's a system of latency that the body uses. It's a way that the body buffers stress. So when you have too much stress in the sinews, then it's going to those pathogens are going to be buffered through the Luo network. So this is where the blood kind of is interfacing with the Wei Qi, because the Wei Qi doesn't have anything to do with blood, right? So this is where the blood is interfacing with the Wei Qi. And you can imagine at this interface here, you have this network that's interfacing here. And at this interface, this is how the blood can come to support the sinews through this interface. And that support comes often in the form of like buffering against some kind of external pathogenic stress. So you can have an acute overload of the system. So the sinew becomes overloaded. It goes into a state where it's like, okay, there's so much of this pathogenic load on the sinew that it's potentially threatening the related organ system. So it's like, okay, this could potentially damage my body in a severe way. So the body uses that Luo system to diffuse that pathogenic stress and buffer it. And this kind of thing, it becomes somewhat nebulous when you start talking about it, because some people will say, okay, you have like a strong mechanical stress applied to the body affecting the sinew, like a car crash. And then they'll say, okay, that strong mechanical stress gets diffused through these microvascular networks. And somehow the mechanical stress is transferred into some vascular, I don't know, diffusion. So sometimes people talk about it in that way, which seems really difficult to grasp, or like it's like it doesn't make sense physically, you know? And then other times they'll say, well, you're dealing with whatever, a viral infection. And then the viral load is too much for the Wei Qi. So the Wei Qi is like trying to put that virus into a latent state somehow, or put whatever it may be into a latent state in the blood. So it's like you'll see people reference it in different ways, but for practical purposes, using Chinese medicine terminology, they would say that when one of the pathogenic factors overwhelms a sinew channel, the sinews will utilize the Luo network as a way to buffer against that stress. So that's pretty much the way to describe it.
How do pathogenic factors relate to emotions? Because when I hear low, I think emotional distress.
Yeah, it can be psychological, it can be physical. All the emotional states are going to be.
Pathogenic factor emotions.
I mean, it builds up like you create like a sort of psychological friction. It's like because I mean, you have like, it's an aspect of the channel. It's like like I was saying with the pulse, it's like the psychological state is just a very yang aspect. It's the shen level of the organ system. So shen means like spirit, right? But shen is like your mind. It's like, it's the mind aspect. So it's an aspect of the organ. It's just the most yang, refined aspect. So yeah, you can have, very direct impact on the organ system. So you have you go into a certain emotional extreme, it's going to start developing like a tension. You could say like it develops like a constriction or a qi stagnation, or it develops a heat, or it develops a cold, or whatever it may be, depending on the organ. So like if it's water, it's going to develop like the fear state develops like a cold. So you start to develop like a depression, like the qi starts to sink. And then if you have with the heart, it does the opposite. Like you have too much heat in the heart, or if you're like in a really happy manic state all the time, and you like think about kids, like two kids that are like laughing, and they go into these laughing fits where they like get each other riled up, and they go and they go and they go. Their qi is rising and diffusing, and it causes the qi to start to scatter. So they'll say like in the Neijing, they'll talk about like joy causes the qi to scatter, fear causes the qi to sink, anger causes the qi to rise. What are the other ones? Worry causes the qi to knot. Yeah. So it causes the qi to become constricted, so it doesn't move properly. That knotting of the qi is really like liver qi stagnation. It's like hypochondrial disorder. Everything gets knotted up in the center and won't diffuse out. So you get these patterns where it's like psychologically, it's creating a qi dynamic. It's like you have a trickle down from the more etheric into the qi realm. It's like the qi, it's creating a qi dynamic. And really, you can use your mind to alter the qi dynamic. You can just like literally tell your body to do something, and often you can get it to happen. So you can use your mind that way.
So, in a way, like if it's like a acute experience of an emotion, but it doesn't stay very long.
Yeah.
Your sinew channel is able to kind of like express that and like let it go.
Yeah,
but
exactly.
If it's like a constant, continuous emotion that you're feeling, your sinew channel just gets overwhelmed, and it's like, all right, we're going to push this to the Luo now.
There will be a threshold. There's like a threshold at which you go above that and you have broken through this like carrying capacity for the sinew. And once you breach that, then you are going to the sinew is going to defer to this other mechanism. Yeah, it'll start to like pull on the like Luo network to be able to like buffer against the risk of the sinew being somehow damaged, or the sinew having to offload that into, you know, whatever, the organ or something like that. Yeah.
Isn't there an adjective like acute or something?
Like
one was more acute, one was chronic.
with the, wait, say more about it.
When the body is faced with a overwhelming situation, in acute situations, it could be the wrong one, but lows are used for the acute ones, and then the chronic ones get shoved into the other divergent channel.
No, really, you can have a case where either you can have like a single moment where you develop a Luo. For instance, when people fall on their butt and they hit their tailbone, almost 100% of the time you get Luo vessels that develop at bladder 40. Almost always. Because it will immediately cause this stress on the system, which puts the body in a panic mode, and you have the inaction of all these things. And it'll happen immediately. Like you look and be like, oh, 5 minutes later, there's like a Luo vessel there. So you can have immediate stressors which cause these kind of things to happen. And you can have chronic things too, and the same with divergence. You can have a chronic pattern which leads to a divergent condition, or you can have like an immediate thing that causes the divergent to arise. Yeah. But yeah, but that's the gist with the Luo. Yeah. You guys probably at this point aren't interested in getting into like treatment principles and treatment strategies with it yet, right, or no? You haven't.
We've just had a brief overview.
Yeah, so you just want to do an overview of it. Yeah.
Not for divergence and not for
Yeah.
entrance.
Yeah, and then you get into primary, of course, and primary is the, this is where you have the Ying Qi. So the Ying Qi, this is vascular. This is associated with the Ying Qi moves with the blood, right? So this is vascular always.
What is the English for Ying Qi?
Nutritive Qi,
Oh.
right? So you remember you have like the Zun Qi. How do they write that? Like that? Like the Zun Qi?
No, the top is a little T.
The true.
It just looks like it has a mustache.
The Zun Qi means like the real Qi, right? It's like the real thing. Yeah. But you have like this the Zun Qi is the broken up into the Yin and the Wei Qi. And so this is where this is coming from. Like the Ying Qi is the Zun Qi. Do you guys remember the physiology with that? Like how that all that stuff? That was probably first year. Beginning. Yeah, it's like you have like when you eat food. Yeah, when you eat food, it gets digested by the stomach. Then the spleen extracts the gu qi. Gu means grains. So it's the food qi pretty much. So it's extracting the gu qi. And then the gu qi is sent up into the chest by the spleen. And when it gets into the chest, it interacts with the lungs. They call it the zong qi. And the zong qi is like the oxygen from the air. So the gu qi it's oxygenated. And then it's infused with the red substance from the heart, and that makes zun qi. So that's where you get like the yin and wei qi. And so primary channels are circulating yin qi. They are vascular. It's the 12 channels. So that's the normal qi. That's the normal everyday qi. Oh, and by the way, the sinews circulate. Do you guys remember this? It's like they circulate maybe like 12 or 20 times a day or something.
Yeah.
It's something like that. Let's say 24.
24 hours.
And then the primary channels, the Ying Qi circulates 1 time per day.
Through all the
24-hour cycle. Or is it twice a day? It goes through it goes through everything. So it must be once a day, right? Yeah, it's got to be once a day. Because, you have 2 hours. It spends 2 hours in each of the 12 channels. Yeah. So Ying Qi circulates once per day. And so this is like a diurnal cycle. On the sinews, you're looking at like, this is like every, I think it's 24 because I think it moves through each channel every half hour. I think it's something like that.
Yeah.
And then,
Is that the one that's in the Suwin, the 20 minutes? That's where our treatment time comes from.
maybe.
I wanna
Yeah.
say that's right. I want to say it was like 18 minutes, but
Yeah, it's 18 odd minutes or just about 20. That's why our treatment slots are.
should be at least.
Yeah.
Hmm.
Yeah.
Yeah.
Because it represents one cycle of the wei qi.
Oh, okay. I didn't know that actually. That makes sense. Yeah. Yeah, and so I mean primary channels. I don't know what to say about them really. Then below the primaries is divergent. Usually they put that here, although divergent is really, I guess you could put it here or here. But divergent is communicating the wei and the yuan levels. So it's in the interplay between the wei and the yuan. And like the Luo, the divergent is a system of buffering stress in the body. So it's a system of diverting stress away from the organs. So when you have a stress which would potentially overwhelm an organ, it can get diverted into the divergent system or into the Luo system, either one. And the difference is the Luo is maintaining this buffering network through the blood as a medium. The divergent is maintaining the buffering network through the Jing, or the kidney yin, as a medium.
I remember learning that using the primary channels, you can access all 3 layers.
Well, yeah, because on the primary levels, you have the Jing well, which will give you access to the sinew. You have the source point, which gives you access to the 8 extras. So yeah, like that, I guess. And you have the Luo point, which gives you access to the Luo. So yeah. And I mean, obviously, because on all these channels, it's like the points you use, the points you're using on these other channels are primary points. Yeah. So yeah, it's like the primary is kind of like marrying everything together.
Got it.
Yeah. But yeah, divergents, of course, are mostly related with the joints. It's the major bony sections of the body. It's the Luo are related with the small articulations in the body, and the divergent are related with the large articulations. So this is helpful diagnostically when people have joint pain or if they have certain types of inflammatory issues or something like that, and you're trying to see, is this more of a Luo issue or more of a divergent issue? So if it's like, hey, come on in. So if it's like the small joints, like if it's like fingers, like with RA, when people get finger issues, like they're small joints, this is like the dip and pip joints and stuff, this is a Luo issue more, because this is the small articulations. And if someone has an issue with like where they have to have a hip replacement or something like that, that's a divergent issue. So the reason people have degradation in the hips is because they have a divergent in there. That's what causes it. Or in any of these big major joints. So when you have a divergent, normally it's either the knees, the hips, the elbows, the shoulders, although this is much more uncommon to have divergence here. Mostly you'll see divergence are stored in the hips, the sacrum, the pelvis, the spine, and the scapula is really common.
I got divergence everywhere.
And it's really normal for people to have divergence. It's like, yeah, it's normal. And divergence are really interesting. I mean, all of the protocol for releasing divergence and everything is really interesting. Have you guys talked about that? Or like looked at how they're the strategies for putting them into latency or releasing them or anything? Okay. Yeah, there's the needling techniques. Yeah, they have like the 3-time needling where you do like Again, I'm of the opinion that you have to be very good at manipulating qi if you use a needle to release a divergent or put it into latency. You have to be able to move qi, and I think most people can't do that with a needle. I think that very few people can do it, actually. I think you have to train a lot for it or just be really gifted. Mm-hmm. It depends on how you look at that stuff. But yeah, the idea is, though, that the divergents are like, it's a continuum between, it's like a sinew plane, like a fascial plane moving into a joint. And so it's like creating this divergent continuum. And so when you're trying to release a divergent, you are trying to polarize the channel toward the surface. So you're normally doing things that cause the person to sweat, and you're doing things that cause the exterior to be released in different ways, like giving them acrid substances and things like that release the exterior. So I'll usually do things like get people to do sauna regularly, lots of sauna. And normally the combination, let's say if you have a divergent in your hip, it would be the combination of opening that joint regularly and doing it in an environment when you're sweating. So like hot yoga is like a way to release divergence or something like that. Like doing something where you are using the joint and you're getting the joint to open physically, opening and closing and opening and closing, and getting the joint to work so the ligaments are doing this. And then at the same time, if you can have the body heated up and you can have the exterior releasing, then you'll be polarizing up toward the surface. And you have to do that for a while. You have to do that on a regular schedule, like 3 times a week for 3 months or 6 months or something. And then the divergent will release. So it's things like that. But yeah, so divergence, I mean, when you have again, let's not get into clinical diagnosis with it because it'll get way too hairy. And then 8 extras. The naming's really weird on 8 extras, right? It's like this is the one. Divergent makes sense. The naming on this it literally means like the name is like to divert away. It's like to branch off. The 8 extras, they call them the chi mai. The words they call them the word is like it's like this or something. Is that how it's spelled? It means like exotic, or it means like
Curious, right?
but it's curious the way the British use the word curious. It's like we don't use that word the same way in American English. It means like exotic or foreign or rare. Like if something's rare or unusual, it's that.
Or exceptional.
Oh, this one?
Yeah, is this how it looks or no?
Is it this one? With like a
It's got
dot and then.
that's it.
Yeah,
Yeah.
Yeah, so it is.
Yeah, so it's like this.
What's the translation?
It's like that.
Extraordinary, not normal.
So it means like, yeah, it's like exotic is kind of the way that we should train. It's because the chi that's moving through there is not normal. It's not the normal chi. It's a rare type of chi, or it's exotic type of chi, or unusual type of chi. So that's why they call it that. So it's extraordinary in the British sense. Like when we say, oh, extraordinary, it's literally extraordinary. It's very unusual, you know. But the naming on this is something that I think, confused me for a long time. But yeah, so I mean, this is totally avascular. So we're getting so again, this is where the blood is here. This and this are avascular. So this is just working with Wei Qi. So this is no blood, interstitial. This is again no blood, and this is just Yuan Qi. And this is dealing with genetics and epigenetics. If you're interested in like the way that they talk about it, the Indians, they would say karmic. This is like your karma. The Taoists would say this is your curriculum here. So it's that stuff. It's like destiny. The Christians would say this is where your destiny is, where they say your destiny is written, predeterminism and all that. It's written in the DNA. So it's like that's all this stuff. So it's like 8 extraordinary vessels are all of that. And yeah, I mean, like I said, I don't think most people are able to move Qi I don't think most people can move Yin Qi very well, so I don't think anybody hardly can move Yuan Qi. I think this is people that can do like faith healing and stuff can affect the 8 extras. So I'm of the belief that, yeah.
Is that equivalent to like the lessons we have to learn, would you say?
Yeah, I mean, it's like, it depends on how you look at it. It really depends on like your religious beliefs on that. It's like, what you, like if you think that you have destiny or that kind of stuff, or, but yeah. That would be like, if there is any kind of pre-written kind of agreement for our life or any destiny for our life, it would be recorded there. Yeah. But yeah, manipulating this. This is where this is the code that makes up the holographic image of the body. So if you are able to change the 8 extraordinary vessels, you are able to change the shape of the body. You can change the hormonal expression of the body. You can change, and it's like all these it's the way the proteins are being transcribed to create our literal shape. So it's like, this gets into like theoretical territory of like shape shifting and stuff, is like being able to change the hormone, change the holographic image of the body. So one question you can ask, like with this kind of stuff, one question that you want to like philosophically ask if you're treating 8 extras is like, do you believe that we're built top down or bottom up? So treating 8 extras to try to change the physical body assumes that you believe that the body is built top down. So there's an energetic holographic matrix of the body which is determining the physical shape. And so you can change that, you can start to affect and alter the primary holographic image and get the physical body to shift. That's the concept.
Wouldn't that be bottom up?
No, bottom up would be that we are growing out of the earth, and it's like we have like this organic form that's primary. And then if there's a spiritual component, that the spirit is just coming and alighting upon the physical body. It's like maybe we create this physical body, and when the body is good, then the spirit can come and live here. But people that think of the top-down approach would say that the spirit is actually seeding, it's primal, it's seeding the actual shape, and then the physical body is formed around the spiritual matrix. So it's like we have this image of ourselves that's like what we're meant to be, and that's like what's written in the DNA, and then the physical forms around that.